Canine Parvovirus, Parvo, is a highly contagious and potentially deadly viral disease that primarily affects dogs, especially puppies. Understanding the nature of this virus, its transmission, symptoms, and prevention is crucial for any dog owner. Here's a comprehensive look at canine parvovirus. The nature of parvovirus. 1. Highly contagious. Parvo is known for its extreme contagiousness. It spreads rapidly among unvaccinated dogs, posing a significant threat, particularly in environments where dogs congregate, such as kennels, shelters, and dog parks. 2. Hardy virus. The virus is remarkably resilient. It can survive in the environment for extended periods, even months or years, and is resistant to many common cleaning products. This hardiness makes it challenging to eradicate from contaminated areas. 3. Targeting rapidly dividing cells. Parvo primarily attacks rapidly dividing cells in the body, most notably those lining the intestinal tract and the bone marrow. In young puppies, it can also affect the heart muscle. Transmission. 1. Fecal-oral route. The most common mode of transmission is through the fecal-oral route. This means a dog can contract the virus by ingesting contaminated feces. 2. Environmental contamination. Parvo can survive on surfaces like soil, bedding, food and water bowls, and even on the clothing and shoes of people who have come into contact with infected dogs. 3. Direct contact. Direct contact with an infected dog can also lead to transmission. Symptoms. Parvo typically manifests with severe gastrointestinal symptoms, including 1. Lethargy. A noticeable decrease in energy and activity levels. 2. Loss of appetite. Refusal to eat or drink. 3. Vomiting. Frequent and often severe vomiting. 4. Diarrhea. Bloody, foul-smelling diarrhea. 5. Dehydration. Rapid dehydration due to vomiting and diarrhea. 6. Fever. Sometimes, but not always. Diagnosis. Veterinarians diagnose parvo through 1. Fecal testing. A fecal test can detect the presence of the parvovirus antigen. 2. Blood tests. Blood tests may reveal abnormalities, such as a low white blood cell count, which can indicate parvo. 3. Clinical signs. The combination of the above tests, and the dog's clinical signs lead to a diagnosis. Treatment. There is no cure for parvo, so treatment focuses on supportive care to help the dog's body fight the virus. This typically involves 1. Fluid therapy. Intravenous fluids to combat dehydration. 2. Antiemetics. Medications to control vomiting. 3. Antibiotics. To prevent secondary bacterial infections. 4. Nutritional support. Providing essential nutrients. 5. Hospitalization. In severe cases, hospitalization is required. 6. Monoclonal antibody therapy. This is a newer treatment that can help to neutralize the virus. Prevention. 1. Vaccination. Vaccination is the most effective way to prevent parvo. Puppies should receive a series of parvo vaccinations, and adult dogs should receive booster shots. 2. Hygiene. Proper hygiene practices, such as cleaning and disinfecting contaminated areas, can help reduce the risk of transmission. 3. Socialization. Until puppies have completed their vaccination series, limit their exposure to public places where they may encounter infected dogs. 4. Disinfection. A diluted bleach solution, 1 part bleach to 30 parts water, is effective for disinfecting contaminated surfaces. Key considerations. Puppies are particularly vulnerable to parvo, as their immune systems are not fully developed. Early detection and treatment are crucial for improving a dog's chances of survival. Parvo can be expensive to treat, so prevention through vaccination is highly recommended. By understanding the nature of parvo and taking appropriate preventive measures, dog owners can significantly reduce the risk of their beloved companions contracting this potentially fatal disease. 1.